Well, not long after we first began to chart the course of this new coronavirus through the population, people began to talk about this mysterious series of symptoms that they experienced as a legacy effect of having caught it. And they ranged in severity, some very mild, some much more severe. Some people, having barely been infected or barely knew they were infected with coronavirus, were then struck down with quite devastating symptoms. And this all became united under the umbrella term long COVID. But actually no one could really agree what long COVID is. But what we think is going on is that we've got this term which unites a prior diagnosis with coronavirus with a constellation of symptoms that occur in the aftermath. And they probably arise for a range of different reasons and a range of different routes and mechanisms in a range of different people in a range of different severities of disease. So the key thing here is that we study this and we try to understand who is it affecting, who is susceptible, and is this really any different from what, if we had a flu pandemic, you would see in the aftermath of flu? Because most viruses do produce some kind of viral aftermath, some kind of post-viral syndrome. And glandular fever is a good example. Shingles is a good example. Measles is a really good example. So is it just that we're seeing enormous numbers of COVID cases, people are talking about it, there's an element of recall bias in there, or is there something else? Or is it actually both? Are there people afflicted in some way by something that's caused by COVID, but also there are other people who are just suffering a post-virus effect that persists for a while? At the moment, I think the jury's out. We don't actually have a definition of what long COVID really is other than this constellation of symptoms. People are aggressively pursuing this though, and if we can come up with ways to identify who's at risk and also to test for who's got some of these manifestations and understand the mechanism of those manifestations. Once you understand how something works, what makes the clock tick, then you can start moving the hands in the right direction. And that's really the direction of travel. But at the moment, we're very much in sort of listening and learning mode because we're dealing with a very uncertain entity.
And actually, the American Medical Association just voted in favor of creating a new medical code, an international classifications of disease code for long COVID. And it's thought now that there are probably 3 types of long COVID. The first 2 are similar to what Dr. Smith was describing, that there's a type that's a result of direct damage from the virus, lung cells actually being killed and the person having to recover from that. The second type is the result of prolonged hospitalization. You get muscle wasting from being in bed that long, you get cognitive changes, and often people require rehabilitation. And then the third type of long COVID is most likely an autoimmune and chronic inflammatory condition. And we're seeing that women are much more likely to get this, which makes sense because women are much more likely to get autoimmune diseases. So we're beginning to sort some of these things out. But one thing that we know is people who are vaccinated are much less likely to get long COVID.
Chris, are you seeing those categories as well that Kate just outlined?
Yes. Interestingly, what we see is people who are not the oldest and not the youngest in the population. So between about age 35 and 60 seems to be the peak age for long COVID. People who are female certainly seem to be affected more often. And we don't know why those relationships occur. It may be that males are more likely to get more severe disease. And so it might be that that's a sort of subtraction phenomenon. It leaves behind women who weren't quite as severely affected, but were affected nonetheless, and they went on to get long COVID. But again, we just don't know. I mean, there's a constellation of symptoms here, as we were just hearing from Kate, and at the moment it's a question of sorting them out and trying to get to the mechanism of what is causing this, and also not conflating it with other things that are going on, because a really interesting story in the UK, but also now becoming an international thing, is that about a month ago we picked up a very big surge in cases of adenovirus, possibly causing hepatitis, swelling of the liver, in youngsters under the age of 5. And one possibility is that this is a consequence either of prior infection with COVID and then this adenovirus on top, or that people, because they were in isolation, a bit like the people in Shanghai at the moment, and weren't catching all the infections that kiddies would normally catch, they're all catching this all at once, and that in concert with something else is now causing them to get this severe manifestation. So it's not just COVID that we're worried about as a new kid on the biological block at the moment. There are other things going on in parallel.